Good afternoon, everyone. Welcome and thank you for joining our webinar today. My name is Addy, and I'm a business development manager at Data Brackets. I will be your host for today's event. I'm joined by our director, Srini Kolathur, who will be sharing technical insights about enhancing your eligibility for QPP and applying for MIPS. Data Brackets has been at the forefront of supporting businesses comply with HIPAA, SOC 2, ISO 27001, and other compliance certifications for over a decade. In our interactions with hundreds of clients, we have ensured they have access to benchmark policies and procedures, staff training, and consulting services by experts to empower them to comply with regulations. For our clients in the healthcare industry, we have helped them comply with HIPAA and meet the eligibility criteria for MIPS. One such criteria is to confirm that patient data is being managed securely. To prove this, your practice needs to undergo a security risk analysis to identify technical vulnerabilities in the way that electronic protected health information, or ePHI, is managed by your EHR system. In this webinar, we will help you understand what is the security risk analysis and how you can partner with a security vendor to get the support you need. Additionally, we encourage you to peruse our guidelines on selecting a security vendor when you decide to go for a security risk analysis, or what we call an SRA. Next slide, please. There are a couple of basic housekeeping rules to keep in mind. The webinar today will be for approximately 45 minutes, including a Q&A session at the end. All lines will be muted during the presentation. I encourage you to submit your questions as they come up. You can simply type in your question in the chat panel on the right side of your screen. And for those of you who have already submitted your questions, thank you. We will be addressing them at the end of the prepared presentation. This presentation deck is available in the handout section of your GoToWebinar panel, and you can download it. We will be emailing you the link to the recorded webinar. You can also connect with us on social media or via email and phone. Next slide, please. I'd like to begin with our disclaimer. This webinar has been provided for educational and informational purposes only and is not intended and should not be construed to constitute legal advice. Please consult your attorneys in connection with any fact-specific situation under federal law and the applicable state or local laws that may impose additional obligations on you and your company. Next slide, please. I have the privilege and joy of introducing our director, Srini Kolathur. Srini is a results-driven security and compliance professional with over 20 years of experience supporting leading and managing global IT security, compliance, support, and risk management in Fortune 100 companies. Some of his key areas of focus are HIPAA, PCI, Sarbanes-Oxley, ISO 27000 series, NIST Cybersecurity Framework, CMMC, among others. He is active in several community groups, including Rotary International and TIE. I could go on and on about Srini's experience and achievements, but will not do justice. Therefore, I'm handing it over to him and requesting Srini to perhaps speak best about his experience and the services offered at Data Brackets. Over to you, Srini.
Thank you, Aditi, for the kind introduction, and good morning, good afternoon to everybody, wherever you're joining from. Thanks a lot for joining today's call. I know this is a pretty popular topic, so we thought we will bring this in this year as well for our healthcare customers. So before I get started, just a quick introduction about Data Brackets. Data Brackets, we pretty much do all kind of assessments. the way we do it is like we have our own platform where like we provide DIY option for our customers who want to get it done by themselves, and we also have certified consultants who could help you in completing any type of assessment that you need. And also like we offer managed security solution, including log monitoring, EDR solutions, and other details. So here are like some of our different kind of assessments that we do for our customers. Of course, HIPAA is like one of the most popular one that we do, and we are a certifying body for ISO 27001. That's a security standard, and also like we help our customers to get ready with SOC 2 examinations and whatnots, and then we partner with our customers to provide the SOC 2 reports. Also, like one of the most popular services is vulnerability assessment and penetration testing for some of our healthcare customers, especially when you're hosting your environment on a cloud-based environment or like in on the internet. Definitely, you want to have all the penetration testing and everything done on a periodic basis to make sure nobody can really hack into your systems. So that's a little bit about ourselves, and so we have pretty much all the leading certification that you would need to conduct these assessments. And also, as I mentioned earlier, we are a certifying body for ISO, and we do have 2 ISO certifications, 17020 and 17021, to conduct these assessments. So here are like some of the terms that you might be hearing a lot during our presentation today for the next 30 or 40 minutes. PHI stands for Protected Health Information. As Aditi was mentioning, ePHI stands for Electronic Protected Health Information. And MIPS and MACRA, some of you might be aware of it, merit-based incentive programs. And HIPAA stands for Health Insurance Portability and Accountability Act. And HITECH is the updated version of HIPAA, which was introduced way back in 2009 or so. So there are a couple of other terms that we would be using as well. QPP stands for Quality Payment Program. And if you have any questions, feel free to use the chat window on your GoToWebinar panel, and then send in your question. We'll be happy to answer them. So let's jump right into our topic for today. So the reason we are here today is to understand more about the requirements for your MIPS security risk analysis. So as you all might be already doing it, so you're participating in the MIPS program, that's why you are here. And there is a big requirement to conduct, apart from the number of other requirements from the clinical side of things in terms of meeting those numbers and the eligibility criteria and whatnot. You are supposed to be conducting a security risk assessment of your environment. So what does that really mean? So that's what it means here. The objective is to protect the patient health information, and the measure for this one is they do refer to some CFR, which is Code for Federal Regulation, which stands for Code for Federal Regulation, another acronym. And so there are these numbers that are listed here: 164.308A1 and the 164.306. All those things are directly referred from HIPAA. So a lot of times we get questions, how is this security risk analysis different from the HIPAA requirement? Technically, they have MIPS or the CMS agency has not added any new requirement to the providers. So these requirements have been existing already, and if you have been doing the HIPAA assessment regularly on an annual basis, and you should have been conducting the security risk assessment as well. Of course, these regulations and the standards, they are really vague and they don't get very specific into what exactly you need to be doing and stuff. What they have done is, as part of this MIPS program, they have created a specific attestation process. Attestation, essentially, you are saying as a entity who's receiving money or who's receiving incentive, saying that like you have completed that specifically. So there is for HIPAA requirement, there is no attestation per se, right? Unless you get audited by the OCR and other agencies or the state agency, you don't need to really attest every year to go into a portal and attest. Whereas like for the MIPS program, they have made this as a kind of a mandatory requirement. Right. Let's look at why are we talking about this topic today. The reason being, as you could see from the numbers here, CMS went about doing audit of about 10% of the entities who have received the payments. There are, we don't have the exact numbers, probably anywhere from 100 to 300,000 eligible hospitals and providers have participated in this incentive program. This is a very popular program, by the way, though. So, and they went about conducting audits of about 10% of the entities. And what they have figured out is there are about 22.7% of the eligible professionals here, like probably you can take them as solo clinics, individuals, non-hospitals, and then the hospital. So about 5% of the hospital, they haven't met the requirement for the security risk assessment, right? So, and so what essentially it means, the repercussions are pretty big. So they could go back and pretty much ask all the incentives or all the money that they have provided to you as part of this program because you failed in their audit. So we have interacted with several of our customers who have gone through this audit. Of course, sometimes it gets pretty exhaustive, but some of them have passed it, some of them couldn't finish it because this is conducted point in time, right? So, and also this is something you should have done it. Let's say if CMS is auditing your paperwork for 2021, you cannot go back in time and conduct the security risk assessment as of 2021. You cannot, let's say if once you get this audit request, then like you cannot go and complete your security assessment unless you want to backdate this thing, which is not recommended, right? So what you want to do is you want to be cognizant about the requirement, and you want to be making sure that you are conducting these assessments during the performance period. Let's say you are testing for 2022 in the beginning of 2023, then you should have started thinking about it now, or you should have at least started conducting your security risk assessment now, right now. Right, so that's the reason actually we are talking about this topic. And so this is the finding. So we obviously want to learn from others, and what we want to recommend as part of the whole the security risk assessment only, because as providers or like as the overall entity managing the business, you all understand the clinical requirements of things, and you know the numerator, the denominator requirements, how many patients you need to see, and how many patients need to be meeting some of those requirements, and the overall requirement for the MIPS. What the providers are lacking from our earlier slide is, they don't understand the requirement of the security risk assessment, right? So that's why we are talking about that topic today. And then when it comes to your MIPS SRA, what you want to, kind of keep few things in mind is, one is, first thing they would ask is, show me the document, show me the report, right? So you got to have something to prove. If you say, hey, you've done it, then like they're going to ask, okay, show me the evidence, and you cannot say like it was done without providing the document, right? That would be considered as you haven't conducted the audit, conducted the assessment. So that's number one. Number two, what they are looking at is they are not expecting you to be 100%. Right, so there are these different requirements, probably about 60 to 70 different controls within this SRA space. They are not expecting you to be 100% completed with respect to this particular requirement. They are expecting you to review everything with respect to your EHR implementation, with respect to how you are handling patient data, and then they want you to identify the risk and have some kind of plan. What does a plan mean? Plan means you have some kind of specific action items in terms of remediating or mitigating the risk that you have identified as part of your security risk assessment, and have a definite start time and definite end time in terms of when you're going to be finishing those things. That's what the plan means. So that's what they're going to be asking you. Okay, apart from this document, okay, does that document cover your identification of risk? Does that document cover the remediation of those risks? And does it have a specific date, time to mitigate those risks and stuff? And then the third thing that they are specifically looking, going back to my earlier comment, you should have conducted that during the performance period, right? So there is no ifs and buts about it. So if you are conducting this assessment in the beginning of 2023, probably you are not eligible for submitting it for 2022, right? So you have to conduct it during the performance period. Performance period is between Jan 1st of the 2022 to December 31st of 2022. So it should have been done sometime during this year. It doesn't matter when exactly, but it's sometime during this one. So what is how is this scored? The MIPS SRA base score is yes. So the base score, essentially the idea here is all of the base score requirements needs to be met, right? No matter what. So you cannot skip them, or it's not kind of optional. And then so there is no specific score, performance score for this particular one, because they are CMS is considering this as like some of the fundamental requirement for handling data and exchanging data and whatnot. And then does it also qualify you for eligible bonus? Nothing. So there is nothing. So this is something, a very base measure that needs to be completed. And then and without that, like, you will not be able to even get any incentive and whatnot, right? So so as we've highlighted here the last line, so if you are submitting no for this particular measure, your base score is going to be 0, right? So that is the way it is done. So here are some of the the high level requirement summary. I think like we kind of covered that. One of the important thing that I wanted to cover is, so you should have been running your EHR system, that's a certified EHR system in 2015 or higher. So that is like another requirement as part of this particular SRA. So yes, all Medicare, like if you're attesting for Medicare or Medicaid, for both, you need to complete this. And then what is an attestation, as we discussed earlier? So this is not like a certification per se. You don't need to get the security risk assessment certified by someone. So what essentially it means is anyone can do this. And like, as long as you think as a business, so whoever is doing it is qualified enough to conduct this assessment, then you're good. And then what does it mean legally? Attestation sounds a little bit unique term, right? So it means legally you are saying that you have understood the requirement, you are able to demonstrate and meet the objective, right? So that's what it means. So and so you are supposed to be maintaining all the supporting documentation, as I mentioned earlier, whether it is paper or electronic format and whatnot. You need to maintain it. And then so you're required to maintain the whole records for up to 6 years. And you could be potentially audited by CMS or the state HHS anytime, like within that 6-year period. So how do you go about even starting this security risk analysis? So everything depends, right? So it depends on the size of your organization, whether you're a small practice or a big hospital or a specialty, not really hosting anything and stuff. And then it depends on the size of your organization, in the sense like, how many sites you have, and whether you are having on-prem servers, or like whether you are using just a cloud-based services and whatnot, just with your laptop and mobile phones. And then also it depends on your complexity of technology and whatnot. So your security risk analysis is going to vary widely, right? Based on some of the things that we are talking about, and also, of course, depending on how, whether you have a single site or you have multiple site, whether you have the same system or multiple systems and whatnot. So the general requirement with respect to the security risk analysis is all of these areas. It might sound a little bit exhaustive, right? But to conduct a comprehensive security risk assessment, these are like some of the things you need to be considering. So if you are doing it yourself, you definitely want to think about some of these things that are listed here. I'm not going to go through this individually, just in the interest of time. But as Aditi said, we have the handout available for you to download. If you have any questions, specific questions and things, we'll be happy to answer after our prepared presentation, or even we will be available via email to answer any questions. So the couple of things that I wanted to bring up to your notice, one is number 2, that is policies and procedures. So a lot of times when we go into any organization, we don't see any security policies or procedures and whatnot. So this is something actually you definitely need to have. So what essentially does that policy contain? So it contains about your overall requirements for managing the patient data. It would say, how would you provide access to a system? How would you terminate a user? And how would you handle the data? How would you classify it? How do you back it up? So the whole 9 yards that requires for maintaining the security of the data. So that is one. So we don't see that a lot. So the best way to probably get started on that one, if you're a small to medium size, we do have several templates just in case if you're interested. So start off with a template instead of creating everything from scratch. Start with the template, update the required sections, and then at least you will have you will be in a pretty decent place to start with. And the next one is essentially the physical security. Most of the places that we are conducting assessment now, they don't have any on-prem or on-site servers and other equipments. Most of them are all on the cloud, and they probably have some kind of a wireless router that gets plugged into their ISP. That's pretty much it. And then they all work off of their laptop or workstation, right? So in that case, the physical security requirement are little bit minimal, right? And depending on your environment, again, as is going back to our earlier this thing, not all of them is applicable for everybody, depending on the scoping exercise that we do initially. So some of them are going to be applicable, some of them are not. Right. So the way we kind of cover as part of our security risk analysis is we take this 6 major areas, right? So your EHR system, your desktop laptops, your mobile devices, and your networking. And if you have any removable media and stuff, so those are some of the areas. And then also your other system that are talking to your core EHR system, say for example your the patient portal and any kind of third party service that connects to your core EHR system, including the HIE, the HIE exchange information and whatnot. So those are some of the things that we kind of cover as part of our this assessment. So couple of things on this particular topic. We've got a lot of calls from our physician community and also hospital saying that they are using a certified EHR, they are using a cloud-based EHR, so they are not required to do the security risk analysis. So that is definitely a myth. We've seen in a lot of audit, people fail their audit because they said they are using a certified EHR. Why should they conduct the security risk assessment? And also they said, hey, okay, cloud-based EHR, so they are responsible. Our cloud vendor is responsible, whether you use Athena Health or Cerner or whatnot, right? So they said they are responsible. So both of them are wrong. So as an entity, who is subscribing to some of those services, you have to conduct your own assessment. So the scope for that might be a little bit different from what the EHR vendor and other vendors are covering. But for you, like, you need to have your own independent security risk assessment done. Right. So let's quickly go over some of the areas that you need to be covering if you are conducting the security risk analysis. So especially when it comes to EHR, no matter whether you are using on-prem EHR or like you're using a cloud-based EHR, you definitely need to configure it according to your the policies and procedures that we discussed earlier. So what do we mean by configuration? So for example, are you going to allow remote connections to your EHR? And if yes, then like there are some configuration setting that you could do, or like you can restrict the connection based on certain IP addresses and stuff. So all of this security related configuration. So in terms of defining the password requirement, defining the timeout parameters, updating the patches and whatnots, all of these things, you are responsible for it. So you need to, as a customer, like you need to make sure that you are configuring it according to your requirements and according to what is the best practice and stuff. And then again, like creating roles within the EHR system and assigning them so that like only people have access based on need to know, right? So that's very important as well. So that will be your responsibility. Although there are certain shared responsibility with your cloud provider. So a lot of the things that are highlighted here are your responsibility, including reviewing the logs regularly to make sure that only the right people are accessing the data and right people are doing what they are supposed to be doing. Right, so that is all the requirement. So all of the things that we are talking about here requires some sort of evidence for you to maintain, right? So for example, if you're conducting audit log reviews, your responsibility is to demonstrate that in case if there is any CMS audit. So what you need to be doing is you need to be downloading these audit log files and then annotating the log files if there are any kind of anomalies that you see. Or like what you need to be doing is like you will be communicating with probably your IT team and other vendors, and so those are like some of the evidence that you need to maintain in case if there are any audit. So it's not enough to say, hey, okay, so we have done the review, and then they are going to be asking, the auditor are going to be asking, what was your process, and what can you show us some evidence of how you went about doing the audits and stuff. So moving on to the next one, desktops and laptops. Here are again the best practices that you want to make sure that you have in place. Of course, when it comes to desktop and laptop, definitely we do recommend some sort of advanced antivirus and EDR solution, right? We call it endpoint detection and response software, so that like when there is any kind of attack that's happening. Most of the time, if you see like all the hacks and all the data breach news that we read, everything starts with some kind of end device that is not protected properly. So a hacker gets into your network through the weakest point, right? So that's why the antivirus and the malware is all like kind of critical. And then making sure that you update your Windows or Apple, whatever you run, whatever OS that you run, making sure you update them. And if you have a large group of people, making sure you have some sort of RMM, the remote monitoring method, to make sure that you are updating all the OS and the patches regularly, and timing out, logging out people if they are inactive after say like 10-15 minutes is usually the best practice. So you don't want to leave your computer on and walk away to do something else and then come back and see somebody else has logged in, right? So and also the most important part is there is no unencrypted patient data on your desktop and laptop. So essentially the reason we are recommending that is if you are going to be encrypting your laptop and desktop, then the burden of proof is just to demonstrate that you have used the right technology to encrypt it, right? So if you haven't encrypted it, then the burden of proof is to make sure that data was not accessed by anybody else, even if you, let's say, you lose your laptop or somebody breaks into your office and stuff, right? So that's why the encryption is something that we definitely recommend, especially for laptops, laptops, desktops, and also your mobile devices and things. So the next item here is like, of course, more mobile-based device, like say your phones, right? So texting and emailing, checking your emails with that potentially might contain some kind of patient data and stuff is becoming very, very common. So obviously what you want to do is like you want to have some sort of, they call it MDM, a mobile device management solution, whether it is your company provided phone or even personal BYOD, bring your own device type of thing. So you want to make sure that all these devices are kind of in a way monitored, and you could do some kind of a remote wipe if the devices are lost, and you do have some advanced protection, including password and the encryptions and whatnot, right? Those are like some of the things we will be looking at when we are doing assessment of the mobile and tablet device. Then the next one is, of course, the networking devices. Even if you are a small shop, you're going to have some sort of wireless router, firewall, and whatnot. So you want to make sure that some of the things that are listed in here are all covered as part of security risk analysis, and you have a better understanding of those devices, right? So the scanning of your networking device, if you have some kind of a public interface, VPNs and whatnot, and then most of these equipment come with default username password. You can just Google their look at the make and model, and then Google the default username password. If you don't change it, then anybody can access it. And then of course the firmware updates and configuring the locks and encrypting the traffic, and all those things are pretty important as well. So this one is also a major issue in the healthcare space. So that's why we kind of calling it out separately, removable media. So especially like thumb drive, USB, and backup tape, CDs, any kind of media that stores, even portable hard disk and stuff. So any kind of media that stores patient data and stuff, everything needs to be in scope. And then what you want to do is definitely want to encrypt them. So even if you lose them, nobody can access it unless they have the encryption key. And then when you're disposing it off, you want to make sure that you follow certain guidelines to dispose it off safely, so that like even if somebody else get access to those media, they won't be able to recover the data. And then especially when it comes to this removable media, you need to maintain an inventory of all these assets within your organization, and make sure that you have a custodian for each one of them, right? Then the next one is pretty much everything else, right? So whether you're talking about emails, whether you're talking about health information exchange platform and the patient portal and whatnot, everything else, right? So you want to make sure that all these integration points are also secured as part of your analysis, and you have some kind of comfort level in terms of allowing them to have access back and forth to your environment, right? So those are like including copiers, printers, we're calling it out. The reason being, we've seen few incidents where the copiers were disposed of without properly sanitizing. So the company, which it was CVS in this case, ended up paying some penalty because the hard disk that was in the copier printer were not wiped out properly, right? So those are like some of the things that you want to consider as you are conducting the security risk assessment. I think like we specifically calling out the security awareness training. So that is one of the key part of the security risk assessment. So no matter what, whoever is handling the patient data, you want to have some sort of program to train them, and also send them some phishing emails and see whether they are clicking on it by mistake. If yes, then that means they probably need a little bit additional training so that they don't click that link next time around, right? So those are like some of the things that we wanted to bring up. And again, on the documentation front, when you're generating the report at the end of the day, once you conduct the security risk assessment, so you're going to be producing this report. It should be dated specifically, what day you started or what day you completed, and then the scope that we already discussed about, and then your identification of risk, and then the plans for prioritizing that risk. Basically, there is a concept called likelihood and impact. So they want to see both of those factors in there, that you use those factors to determine the risk, and then target date for completing them and stuff. And then, of course, they will be looking at your policies, procedures, and whatnots. And then, when you're conducting the audit log reviews or training, if you're conducting training, auditors want to look at, all those logs and whatnots. So I think like some of these things were already covered, so I'm just, in the interest of time, I'm going to skip it. And then, so here is the audit process in case if it happens for you, if you are the lucky one to be selected. So there is going to be an initial request, and then they will review all the documents that you've submitted, and they might even decide to do on-site review. And if then they will determine, auditors will determine if you are eligible or not eligible. So you will be getting audit determination letter. And of course, if they determine that like you're not eligible, then you can go through the appeal process as well to plead your case. But again, it all depends on how well you have done your documentation. That's why we are kind of stressing on the documentation. So here is like some of the sample letters that you will get from CMS if you are going to be audited. And it has all the details of it. So just in the interest of time, I'm going to skip those part. And as I said, like you'll have a copy of this handouts. So go through that. If you have any questions, we'll be happy to answer that. And then again, the findings, there is no formal security risk analysis. The process that we outlined just now is like more of a formal process, which is a comprehensive, which covers everything, soup to nuts. And so nobody can contest that it was not a formal one. And then the next one is, of course, the last one is the security risk analysis not conducted during the performance period, which we already talked about. So you also want to, as you are, you might decide to outsource this activity, or like you might do it internally. If you are, identifying a vendor to conduct this thing, so please, this is a hyperlink. You can click on this, and we published a blog on how to go about selecting the best vendor for the security risk assessment. And so what are the next steps, right? So if you are an entity like trying to get this MIPS SRA done, or like if you're already providing this service, we do see some consultants also join this call. So if you if you do provide this service to your customers, so there are a couple of options. One is do it yourself. We do have a nice platform that is available for you to conduct your security risk assessment. So we have, as I said, like ours is a security assessment shop, and like we do have several assessments, and you can go through the information in here. And like as you could see here, like you could pretty easily go in and do all your audits, all your assessments that are required for your MIPS program. And then like once the assessments are done, like you will have the action plans generated. And once action plans are generated, then like you go into your executive summary, and then like you will essentially go through the individual risk that you have identified, and even you can determine the risk based on the impact and the likelihood, as I mentioned earlier. These are like some of the finer points that they are looking at, whether you use these factors to determine the risk, and then go through the process of identifying the risk and prioritizing the risk, and then generating the required report, right? So the reports is going to show you the score. As I mentioned, the score, they are not going to come back to you and say, hey, okay, your score is only 63, you need to be 100. No, that's not the case. As long as you have the risks identified and you have an action plan, then you're good with that, right? So switching back, so that's the platform, quick review of our platform. So that's the platform you would use to do your own security risk assessment. If you are hard pressed for time, or if you think like you don't have the expertise to conduct this assessment, then you can hire our certified consultant to conduct this. And so we'll come in and of course use the same platform, but that will be a very comprehensive assessment. Or like you could also go with the hybrid approach where you could do the assessment and then hire our certified consultant to get your input, like wherever you have questions, and if you are not very clear on a particular control and stuff, you could get those things clarified. So that's a hybrid model. And so these are like the different services that we offer for healthcare industry. Of course, HIPAA being one of the most popular one, and we offer HIPAA training, online training, and then MIPS MACRA, SRA, and we can even just develop your policies, procedures. If you have your own software, hosting services and stuff, so we could do the pen testing and the security risk analysis. So here are some useful links for learning more about this particular topic. As I mentioned, if you have questions and stuff, please feel free to reach out to us. With that, I'm going to turn it over to Aditi. Aditi?
Yes, Srini, thank you so much for all those insights. We have had quite a few questions since we launched this webinar and announced it. I've included them here in the deck, and we look forward to knowing, first of all, what is the difference between the requirements for HIPAA, high-tech, and MIPS security risk analysis? Are there any?
Sure. That's a great question. I think this we get asked this question a lot. So as I mentioned earlier, so there is really not a lot of difference between the security risk assessment requirement of HIPAA and the MIPS. So MIPS, if you go back to the MIPS requirement measures that we shared earlier, so MIPS pretty much talks about the HIPAA CFRs, code for regulations, right? So, and the idea here is they are specifically calling out the security risk assessment requirements from HIPAA, and that's what they want you to complete. And however, the one thing that you need to keep in mind as you are conducting this MIPS security risk analysis is the scope for your MIPS security risk analysis is slightly narrow. In my mind, compared to your overall HIPAA assessment. So CMS is primarily concerned about your EHR system and the system that are interfacing with your EHR. That's what the MIPS security risk analysis is concerned about. Whereas HIPAA, it could be much larger, in scope. HIPAA security risk assessment that might include some of the systems that are not even interfacing with your EHR, and those are like kind of standalone devices and assets. So that all need to be included as part of your HIPAA security risk assessment. Whereas in MIPS, it's primarily your EHR system and any system that are interfacing with your EHR. Hope that helps.
That's pretty accurate. Could we move to the next slide for the next question? So when do we need to start and complete the MIPS SRA? Since you mentioned the performance period from Jan to December, when should we start? When should we complete? How long should this SRA be?
Yeah, I think as I mentioned, so it could be or done anytime during this performance year, that is Jan 1st to December 31st. So there are a couple of tips. One is, usually this kind of security risk assessment based on our experience takes anywhere from 3 to 6 weeks. So you want to start sometime in September, October timeframe, so that you are done with it before the end of the year. That is one. And the second one is in terms of comprehensive assessment, is something you don't need to really do every year unless there are some significant change in your environment, a significant change in new sites and whatnots. If the things haven't changed much, like say between 2021 and 2022, essentially what you need to be doing is you need to be updating your 2021 report and making sure that the scope and other things that are included in 2021 hasn't changed in 2022, and then updated according to current status. So that will be my recommendation for that.
Perfect. Thanks to everyone who's staying on. We just need a few more minutes of your time since we have questions regarding the cost and the duration, validity. So could we move to the next slide, please, Srini? Um, Again, I think coming back to how often should we conduct this security risk analysis for MIPS? Is it every year?
Yeah, Aditi. Actually, I think this is an excellent question. So yeah, definitely this needs to be conducted every year, and they want to see the dated security risk assessment for that particular performance period. So as I mentioned, I think we discussed about this a lot, and also this is one of the key audit findings. So you need to have this conducted every year. And secondly, yes, there are some tips and techniques in terms of how much you want to do every year, right? But then definitely you want to start off with a comprehensive assessment for the first year, and then next year onwards, if there are not many changes, then you want to just do an incremental update. So that would be our recommendation, but definitely every year.
Perfect. Could we move to the next slide, please? So how long does it take to complete the security risk analysis? You've mentioned 3 to 6 weeks, but is that for the comprehensive one or is that for the incremental one?
Yeah. So for that 3 to 6 month, 3 to 6 weeks is for comprehensive, and of course, this is just kind of ballpark, and the size, it all depends on the size of the company and what kind of footprint they have and things, but I'm just kind of generalizing it. But if it is a much larger hospital and things, of course it could even run for a few months, and if it is a small clinic, maybe in a few days or so also we can complete it. But in terms of the incremental one, it definitely depends. So probably I would say about 20-25% of your initial effort is what required for initial incremental assessments. Hope that clarifies.
That sounds very, very interesting, Srini. Because if it's just 25% of the effort, and you get a lot of incentives once it's all done, it's very much worth your while.
Yes.
To undertake this. Could we move to the next slide, please? This is the big question that we've been asked. What is the cost of a MIPS SRA?
Okay, that's a good question. Again, we won't be able to generalize. Generally, the way we do the costing for MIPS SRA is if people want to do their own DIY type of a security risk assessment that we offer online. So that's probably somewhere around, for a small clinic, that will be somewhere around $500-$600 range. And if they want us to come in and do our assessment, then it could vary from anywhere from, for a small clinic, it would start off from say $800 to $1,000 all the way to several hundred, at least several thousands, right? So that's how it is, and basically it's it depends on how many number of hours we need to put in to complete the assessment. So sorry, I could not be very specific, but I think you kind of got some numbers there.
Absolutely, absolutely. Could we move to the next slide, please? So what is the format of this final SRA report? which you have to submit as part of your eligibility?
Yeah, I think this is a great question. So I don't know, I can kind of cover everything in here as part of the format, but what I could say though is, you want to, in the report, you want to have the overall summary, right, to begin with, of the assessment, and then you want to know the individual, you want to list the individual controls that were tested and the status, and also the gaps that you have identified, and then the approach that you have used to prioritize that gap. That essentially becomes your POEM, right? Like plan of action and milestone. And then so on the dates for completing or remediating those gaps. So those are like some of the key part of your security risk assessment report. We've seen a lot of people use Excel and stuff, and some people use Word document, and of course we use our own platform where the platform generates automatically with all these details and stuff. Yeah.
Wonderful. This has been extremely helpful. If we could move to the next slide, please. We'd like to thank everyone for your time and for being engaged with us, whether you're watching the recording or you're here live. Please feel free to get in touch with us via email, calling, or through social media. We would really love to hear from you. And we'd like to thank you once again. Thank you, Srini, for your time.
Thank you. Thanks, Aditi. Thanks for, yep.